Next up, we invite Abbey Kaler, who is a passionate nurse practitioner navigator from the Advanced Breast Cancer Program at MD Anderson Cancer Center in Houston, Texas. This ABC program works to enhance the quantity and quality of life for patients living with metastatic breast cancer. Abbey holds a variety of degrees in a bachelor's of degree in nursing, as well as a master's of science degree, and is currently working on her doctorate at the University of Texas Health Science School of Nursing. Her research really focuses on the importance of systematically incorporating the patient voice into clinical care, and I'm excited to hear about Abbey's presentation today. Welcome. Thank you.
Thank you so much, Dr. Blaze, and thank all of you for being here today. I'm really excited to share with you the wonderful work that the Advanced Breast Cancer Program at MD Anderson has done over the last 5 years. These are my disclosures to share. Founded in 2014, the Advanced Breast Cancer Program was a dream of advocates living with advanced breast cancer to create a program specifically designed to support and address the unique needs of patients living with metastatic and advanced breast cancer. Unfortunately, many of these patients are no longer with us, but their dream lives on in the work that the ABC program does every day. We thank them for their perseverance and their determination to advocate for themselves and for future patients. The ABC program is uniquely poised to set the standard of care for advanced breast cancer as it was created for patients by patients. The ABC program is guided by a multidisciplinary steering committee in which a passionate group of 15 patient advocates are at the core of all of our initiatives and our strategic planning initiatives. I would also be amiss if I didn't acknowledge Dr. Dabu Tripathi. Thank you for your guidance and your leadership. It is your vision and your dream that the ABC program is where it is today. Before we dive into the program specifics, I'd like to highlight some of the patient quotes on the impact of the ABC program on their daily lives and their sojourn with advanced breast cancer. Anna says, "I was first diagnosed with metastatic breast cancer in January of 2020. I was 69 years old, living in North Carolina, and I came to MD Anderson in 2020 for a second opinion. I after decided to move to Houston to continue my treatment. Soon after the COVID-19 pandemic hit, my life became very isolated. I began to struggle emotionally, and my oncologist suggested I reach out to the Advanced Breast Cancer Program to join the support group. I did, and quite frankly, it was a lifesaver. It was great joining the group every Wednesday and the webinar every Friday." Dawn states, "The metastatic patient now has an opportunity to see a dedicated internal medicine physician who can coordinate our care with our oncologists." And Peggy shares, "Learning about all of the departments available to me as a patient, such as integrative medicine and supportive care, has been a godsend." The long-term goal of the Advanced Breast Cancer Program is to be a model of best practices for the treatment and comprehensive survivorship care for those patients living with advanced breast cancer. It will be disseminated throughout the country and the world and continually refined to cultural and patient preferences. The NCI Office of Survivorship held a conference in 2021 to understand the needs of those patients living with likely incurable or advanced cancers. Their first conference identified 5 key areas of research opportunities: healthcare delivery, symptom management, psychosocial support, epidemiology and surveillance, and health behaviors. The ABC program is currently working to create a strategic plan in line with the MD Anderson strategic vision and the NCI Office of Survivorship defined areas of need. You can see the key areas outlined in the green boxes, and the black boxes represent the initiatives that were pre-existing to MD Anderson and the Department of Breast Medical Oncology. The blue boxes highlight the enhancements that the Advanced Breast Cancer Program has been able to grow since being founded in 2014 and onboarding staff just 5 short years ago in 2018. MD Anderson currently serves a population of over 2,100 patients living with advanced breast cancer, and our goal is to reach every single patient through these services and support mechanisms. And just a quick little timeline. Beginning in 2018, we began our initial individualized patient navigation program. And in 2019, continued with our peer-to-peer matching platform, as well as developing an ABC electronic health record report. We utilized the challenges brought forth by the COVID-19 pandemic and shifted pre-existing educational webinar and support group to a virtual environment, which is now the heart and soul of our program. You'll hear about later the IRB-approved comprehensive registry we were able to begin. In 2021, we collaborated with our internal medicine team and created the LIMS Clinic. We continued with quality improvement projects, looking at our portacaths and the patient wait times to have their port accessed. We conducted an oral oncolytic project, patients receiving labs at home and following up via a video visit. In 2022, we began an advanced care planning initiative, educating both our providers as well as our patients, and we're beginning our dissemination. And I'm so excited to be here with you today to check that box. And in 2023, we look forward to collaborating with existing subspecialty disciplines such as geriatrics, energy balance, and beginning a digital health coaching clinical trial. The ABC program started as a vision of patients, and we describe ourselves as a program for patients by patients. The future research of the ABC program will explore the integration of the patient voice into cancer care. And as our first step, and as part of my doctoral work, we defined the concept of patient voice as verbal or written communication by the patient to their healthcare provider to positively influence their quantity and quality of life. So now that we have a working definition of the patient voice in metastatic cancer, our next step is to explore how patient voice impacts patient empowerment and uncertainty, and ultimately their overall quality of life. The hallmark of the ABC program is the work of an APRN navigator to support the patient's many individual unique needs. We utilize a checklist approach. The patient meets with the APRN navigator within 1 to 2 weeks of meeting with the oncologist to continue the discussion and assess for any gaps in care that may exist. Patients meet with the nurse practitioner navigator via video visit for up to an hour-long appointment. And I'm excited to share that we are in the process of hiring a second APRN navigator, and this will more than double our clinical capacity to meet clinical demand. We are able to integrate with our robust clinical research department to look for gaps in our current processes and to create a model of best practice to deliver personalized therapy. One of the initiatives we look forward to is collaborating and streamlining the way that patients are currently triaged for clinical trial screening and genomic testing. We collaborate and integrate with subspecialty departments and disciplines to offer coordinated multidisciplinary care, such as cardiology, pulmonary, GI, etc. We've collaborated with our internal medicine department for the diagnosis and management of our patients' comorbid, non-cancer related medical conditions, as well as partnering with our integrative medicine and our supportive care departments to address our patients' symptoms and holistic approach to cancer care. As I shared, we have collaborated with our internal medicine department, and we've created the LIMS Clinic, linking internal medicine and metastatic breast cancer for success. The LIMS Clinic provides oncology-coordinated internal medicine services for ABC patients that are unable to secure a primary care provider within the community. Previous literature suggests that the primary care physician's role is less active when breast cancer patients receive active cancer treatment. And this finding was consistent with the voices of our ABC patient advocates who reported difficulty in receiving their oncology-coordinated internal medicine services due to their terminal diagnosis and the indefinite prescription of active cancer treatment. ABC patients with high comorbidities have a threefold higher overall mortality rate than those without comorbidities. And so therefore, with the increasing life expectancy of our ABC patients, there is a growing realization of the importance of managing medical comorbidities in coordination with our ABC patients' cancer treatment. I'm excited to share that we have a poster on Thursday morning at 7 a.m. if you'd love to stop by, where we'll present our findings of the LIMS clinic in full. But a short highlight is that our LIMS patients had significantly higher rates of hypertension, type 2 diabetes, hyperlipidemia, and hypothyroidism compared to our other MBC patients in general. And LIMS clinic patients had lower rates of anxiety, depression, and menopausal-like symptoms. There is a population of ABC patients with significant comorbidities, and further research is needed in this area to understand what comorbidities are most experienced by our ABC patients, and the creation of policies and initiatives that are specifically designed to support and address these comorbidities. We look forward to partnering with our community primary care providers to bridge the gap between academic and community centers to provide comprehensive care for our ABC patients. Psychosocial support. The ABC program offers a support group for patients who prefer a group environment and peer-to-peer support matching for patients who prefer a more intimate one-on-one experience. We have found that peer support is pivotal for patients finding and utilizing their patient voice. Patients are able to emotionally support and learn from one another's similar experiences. Our support group is moderated by a licensed professional, either myself or one of our social work colleagues, to ensure that medical information is correctly shared, as well as to follow up on any clinically necessary items such as extreme distress. In the wake of the COVID-19 pandemic, we transitioned our monthly in-person support group to now weekly and virtual. The support group is now the heart and the soul of our program. Continuing education. Following suit, like the support group, prior to COVID-19, we held in-person quarterly town hall meetings. We were no longer able to do this when the COVID-19 pandemic began, and so we also transitioned our educational events to a weekly educational webinar beginning in April 2020, excuse me. And since then, we have held over 130 webinars, and you can see the slide on the right of all of the various topics that we have covered and the very diverse offerings to our patient community. And through our webinar, we have found that we have created an empowered community of patients, mostly due to the reoccurring digestible format. You can see that our webinar has featured presenters both within MD Anderson as well as externally, and our attendance numbers continue to grow year over year, and each week we serve about 23 participants on our webinar. I'm also excited to share that we have a poster on Friday morning about the impact of our webinar. We administered an electronic survey that was mostly completed by metastatic breast cancer patients, both patients at MD Anderson as well as other community centers. The respondents said that the series positively influenced their interactions with their healthcare providers, influenced how they think about their metastatic breast cancer diagnosis and experience, and it provided them an opportunity to connect with others like themselves. And respondents reported actions taken based upon the webinar series was that they shared information learned with their family and friends, they joined a support group, they spoke with a provider about resources shared, they started a new healthy behavior, or they joined a clinical trial. And so this is an invitation for all of you to join our community. The ABCs of Healthy Living in Challenging Times educational webinar is held every Friday at 1 p.m. Central Time via Zoom. It is open to everyone: patients, caregivers, faculty, staff, community members. If you're interested in attending, please email us. In the fall of 2021, we implemented patient-reported outcome PRO collection breast center-wide. We know that the symptom profile of patients living with metastatic breast cancer are impacted by numerous variables, such as their disease burden, treatment plan, comorbidities, and their current supportive care regimen. And the collection of patient-reported outcomes has been shown to improve patient satisfaction, improve quality of life, decrease emergency room visits and hospitalizations, and increase overall survival. We've partnered with a third-party company, Ronin, in which we offer their patient electronic device application. Their content aligns with the PRO CTCAE and CTCAE guidelines. That also offers additional clinical questions to deliver deeper clinical insights for providers when they are triaging their patients' symptoms. As I said, patients are able to track their symptoms through a patient electronic device app, and at the time of symptom report, the patients will receive an alert tier based upon their symptom responses. If a moderate or severe alert is triggered, the clinical team will be notified via in-basket messaging. If a life-threatening alert is triggered, the patient will be directed to the nearest emergency room. The app contains a dynamic call nurse button. If the nurse button is pressed during business hours, the patient will be directed to the triage line within the breast center. If it is after hours, it will connect the patient to the after hours call nurse line. The patient is able to receive tailored patient education at the time of symptom report. We worked with our patient education department to utilize all of our pre-existing patient education documents. The patient has the ability to view short, condensed, or full PDF patient education documents. It integrates within our electronic health record, and it alerts the clinical team if a response over a predefined threshold is alerted. We're excited for future research to report the symptoms experienced by our patients and the ability to influence and enhance our current standard of care practices. In 2020, we received IRB approval for a retrospective and prospective data collection protocol to track and describe our current population. A comprehensive registry of metastatic breast cancer patients' medical records and histories will assist our researchers in designing future therapeutic and quality of life trials. To date, we have enrolled 160 of our goal 1,000 patients. And in closing, in response to the NCI Office of Survivorship recognizing patients living with likely incurable or advanced cancers, they released a funding announcement. We submitted a proposal this past fall entitled Empower. Empowering metastatic breast cancer patients to overcome distress and uncertainty with the use of navigation, education, and resources. Our three aims look at the role of navigation and its impact on quality of life, personalized therapy engagement, and goals of care engagement. We want to learn, does navigation have an impact on patients participating in clinical trials, completion of their advanced care planning directives, emergency room visits, inpatient admissions, and their overall quality of life? Thank you so much for allowing me to share the great work of the ABC program has done over the last 5 years. We have a lot of work left to do to continue the original mission and dream of our founding patient advocates and for current and future ABC patients. Thank you.
Thank you very much for that excellent talk and example of what a program can do. Please go to the microphone if you've got questions. I see a question here.
Thank you. This is actually more of a comment, I think, but thank you. And I'm a health outcomes researcher, so I applaud your diving into patient experience data. and that now that the FDA actually accepts it as legitimate data, I think the whole field can start to benefit more from patient experience data. My comment is that I think that there's a disconnect between PROs and patient experience data, and that most of the PROs that are currently being used, particularly in palliative care, particularly around quality of life and disease burden, are older, inadequate measures. It doesn't surprise me why in the first talk there wasn't a significant improvement in quality of life for services that should have shown that. So I would just encourage that we become more diligent in actually how we're developing our evidence base and using measures that more reflect what's actually happening.
Thank you for that comment. As I listened to your talk, Abby, I think that the registry that you are building with some of those experiences and PROs actually lends itself to potentially some real data answering, or hopefully answering some of the questions that you mentioned. At the microphone over here.
Hi, Deborah Collier, patient advocate again. So this is a great program. Thank you very much. I'm wondering, are your weekly webinars recorded? And have you thought about how that could be extended to broader patient communities itself?
Yes, absolutely. That's a wonderful question. Unfortunately, due to current legal concerns and patient privacy concerns, that is something that we are milling over every single day of how to be able to record our webinars and to be able to share them with the public. So unfortunately, they are not recorded at this time, and you do have to catch us live. However, if you do email us to participate, we do administer a schedule about 4 to 6 weeks in advance, so that if you are interested in attending a specific topic, you can make plans accordingly. But I definitely do hope that one day we will solve the challenge of recording our webinars and have that available.
So I have a question too, wearing my survivorship hat and how to live well after a cancer diagnosis. Oftentimes these programs are, we see the benefit of it, but figuring out how to pay for them is actually really a problem when you talk about the applicability at other institutions. And I'm wondering if you can share some insight how you've done this so far.
Yes, that's the million-dollar question, Dr. Blaze. And so my work as a nurse practitioner navigator is billable and reimbursable as a nurse practitioner, a certified nurse practitioner, as well as our main mechanism of funding is through philanthropic support, both donors as well as grant opportunities. And so we're really excited about the NCI's new opportunity and funding mechanism, as our program does heavily rely on funding support.
Yeah, I think that's one of the hardest challenges to apply it to all the institutions that people in the audience are at, is how do you pay for it and keep it sustainable? Question at the microphone.
Hi, my name is Sheila Godreau. I have been living with metastatic breast cancer for 7 years. My question is, within clinical trials, we see there are groups that are underrepresented. Are you seeing similar trends within adoption or participation in your program? So Latinos, African American, men.
I think one of the goals of the ABC program is to increase our clinical trial enrollment across the board, as well as continuing to ensure that we are equal across our races and ethnicities. And so that's actually one of the programs that we will be looking into launching in 2023, is how can we standardize and streamline our current process. As a patient, I'm sure you're very familiar with that time when it's time to, okay, we have to change a trial. Well, now there's like all these questions that we have to answer, and it can be a very confusing and stressful time for patients and clinicians alike. And so really diving deeper into what robust mechanisms can we put into place to streamline that very difficult and stressful process.
Microphone?
Yes, thank you. My name is Sabine Sisling. I'm from the Netherlands Comprehensive Cancer Organization, and we host the Netherlands Cancer Registry. I'm a clinical epidemiologist, and I'm very keen on the app you showed the patient can really contact nurses in the hospital, and that you're trying to set up a metastatic registry. It connects to the previous question. How do you prevent the participants of your registry to consider to have any bias? Because the patients have to use the app, I suppose.
For enrolling in the patient-reported outcomes tool.
Yeah.
So currently we are in the phase of implementation, and so those are absolutely barriers that we are currently working through and absolutely acknowledging. But we are hopeful that with such a large enrollment, our goal is 1,000 patients, that by the time we enroll that many patients, that we will have addressed some of those initial biases that we're currently experiencing.
I think we've got time for one more question.
Hello, my name is Ashley Dedman. I'm with the American Cancer Society. Thank you for your presentation and all the best with your doctoralship. My question is kind of a secondary question from, I know you shared that the link to the webinars it's live, so you can't share them. So my question is, what partnerships do you have implemented or have you thought of? I live in Houston, so I'm kind of asking just to kind of get a background. Do you have any partnerships or have you thought about partnerships with organizations that are serving those under-supported communities to be able to get their communities access to those live links so that they're able to participate and benefit from this from the program? Thank you.
Yes, absolutely. It's a wonderful question. Living in the age that we do, cybersecurity is a real concern. And so the best way that we have found to make sure that our link stays private and with the intended audience is through a reoccurring email list. And so we invite anyone and everyone that would like to participate to join our list. And because the webinar is recurring every week, we love to partner with various agencies, whether you are a small nonprofit or another large academic cancer institution. This is a community event, and we love fostering a community spirit, a connection of our patients and our clinicians. And so absolutely would love to partner with any and all of you to bring your communities on board. We already have the program and the platform established, and there's no limit to virtual these days. So we'd love the opportunity.
Thank you very much. Let's give Abbey Kaler a round of applause.